What a beautiful day in Hawaii. Thank you all for showing up or watching the replay here. So, today we're going to talk about um, food, well, I should say food intolerances or common hidden food intolerances with people, kids and adults with ADHD. So, it's something that I think a lot of people misunderstood. And I think the reason why I want to talk about this today is because there's some question about it in the Facebook group last week. I can't quite remember. But anyway, that's what we're going to talk about today is common food sensitivity. Um, so let me get started and started with kind of defining the difference between what exactly is food allergy because I find that a lot of people throw around the word food allergy kind of like casually without really much understanding. So the way I define food allergy is when you eat something and that food causes an actual allergic reaction. And when I say an actual allergic reaction, I'm talking about an IgE mediated response. And that's the usually you'll see physical manifestation. Like if you have ever watched the movie Hitch with Will Smith in it, there's a scene where they were at this kind of like a party where they prepare their own food and he's allergic to shellfish and accidentally eat something I think have shrimp in it, and his face swelled up, his lips swelled up, and he has to take Benadryl, like drinking a whole bottle of Benadryl. So that kind of reaction is usually an actual real allergic reaction where IgE, which is the immunoglobulin E, is actually activated. So that's a real food allergy. Real food allergy or any kind of other real allergy triggers an actual immune response, and those responses usually happen within minutes and happens really quickly. And so that's the food allergy that kind of this or the food allergy. So when I say food intolerances, I'm talking about eating a food that can cause a tummy aches or some other more subtle response. So when it comes to food intolerances, your body is not reacting to it. There, well, your body is reacting to it, but not your immune system reacting to it. And that is the reason why food intolerances doesn't show up on blood tests. Blood tests that your doctor do in the office or at the lab, blood tests, skin tests, only look for IgE mediated food reaction. So anything that doesn't trigger the doesn't trigger immune system will not show up on the blood test. Other things that would not show up on blood tests is of course things that are not tested on the blood test. So then food intolerances will be something that um, is more like irritation. The way I explain is kind of like eating spicy food, right? Some people can eat like super spicy jalapeno, ghost pepper, and their face don't change. But then some other people like me, just a tiny touch, and I'll be screaming like burning in hell. So it, food intolerances is kind of like that, but not quite exactly like that. So, and then the other thing I also want to clarify is celiac disease. So with celiac disease, so there's celiac disease and gluten intolerance. So people often think that they have a celiac disease or gluten intolerance, but it's totally two different things. Both celiac disease and gluten intolerance um, both require a gluten-free diet, but the cause is completely different. In celiac disease is an autoimmune disorder where the body actually attacks itself because it is confusing some of the body tissue um, to the gluten protein. So that's celiac disease. And celiac disease is actually a lot more severe because it can cause permanent damage to the intestine and also increase your risk for intestinal cancer. So the treatment, same thing, a gluten-free diet, but that gluten-free diet has to be way more meticulous, have to be very clean and careful, and that not just the diet. We're also looking to like things that comes in contact with the skin, like shampoo, lotions. Like in little babies, we even look at the type of diapers they're using and everything that touch the skin, because a lot of um, a lot of the things that are added to the food and manufacturing process of skincare product might contain some kind of gluten or gluten derivative. So that's the celiac disease. And then on the other hand, some people might have, they'll say, oh yeah, every time I eat bread, it doesn't make me feel good. So there's also gluten intolerance. And intolerance is kind of like most people are familiar with lactose intolerance. So these are not allergic reaction. It's just that your body doesn't have the enzymes or the capacity to break down those foods, and that's the reason why those foods are causing issue. So same thing as in the gluten intolerance. For whatever reason, some people when they eat gluten product, they get stomach upset and a lot of issue with it. But that doesn't mean that because your blood test for for the celiac blood panel is normal, but you're reacting physically and mentally to gluten, that means that nothing's wrong with you. So, and that's the reason why a lot of times parents ask me, oh, can we do a blood test? And my answer is usually no, especially in very young children. You don't want them to go through the trauma, getting that needle poked, especially if it's something very scary for them. And second of all, there's a lot of false negative, false positive, because again, not everything is going to show up on the blood test or the skin test. And then with food intolerances, depending on what it is, it could be an intolerance to the protein. So that will be the gluten intolerance would be an example, is that your body is not tolerating the gluten protein. And then you could be intolerant to sugar. So that an example would be a lactose intolerance, because lactose is a type of sugar in milk. And for some people, and actually most adults, we as we grow up, we actually lost the capacity to break down sugar from the milk. So that's the reason why as we grow older, we kind of like further staying away from milk product, because our body just not meant to drink that much milk as we get older. Um, yeah, so those are intolerances, and actually there are even more, because there are some people cannot process other type of sugar in our body, and there are tests for that, and your GI doctor can also look for symptoms and send you for the right testing. So yeah, so those are kind of the difference between an actual food allergy and food intolerance. One's trigger an actual immune response, and the other one doesn't. So then that's kind of like where the problem is with a lot of these things. And that's, I think that's why I want to clarify, because I get a lot of questions or comments in my social media space, in the Eat to Focus space, where people don't understand like why I will suggest avoiding milk or avoiding a lot of commonly seem like healthy kind of food. And the reason why is that people don't recognize that some of the ADHD symptoms could be actually the results of food intolerances, even though your blood test is negative. But people often expect that, oh, if my child have a reaction to food, then I should see reaction, it should show up in a blood test. But I'm telling you that it is not always the case. With food intolerances and food allergy often share very similar symptoms, like problem with breathing, skin rashes, stomach pain, nausea, vomiting, some of this. But then again, there's subtle differences where um, an actual allergic reaction, the reaction comes a lot quicker, within a few minutes or within an hour. But with an intolerance, those symptoms might not show up for days, or at least a couple hours, sometimes for days. And with all of this, it could also affects the mental state or the behavior, right? Because when you're not breathing, of course you're in distress mode. But in food, with food intolerances, because the symptoms are more subtle, you will never ever see anyone who reacts to eating anything with gluten or milk. Well, I should not say milk, because sometimes kids with milk allergy do get projectile vomiting like quite immediately. But say gluten, let's use gluten as an example. You'll never see someone eat some kind of bread and immediately has an anaphylactic reaction. That's almost never happened. Even with the celiac disease, um, it's more chronic disease and the symptoms is still very mild in terms of presentation, but it's the damage is very severe over years, and most people don't get diagnosed till years later, or they were diagnosed by accident. But yeah, so with food intolerances, a lot of times you can have like behavioral kind of reactions, so like lack of focus, the memory is not good, getting more angry, upset, irritable, tired of those, and that's kind of some of the reaction to intolerances. And then when it comes to food allergy and food sensitivity, we're also looking into digestion as well, right? Because we have to also look into why suddenly some of these food become an issue, and part of that problem or part of the cause could be because of poor digestion. So normally when we eat food, the food is all broken down to fundamentally a few things like protein, well, actually more specifically amino acid, glucose, or different kind of sugar, glucose, galactose, or lactose, and what's the other one? Fatty acid, different type of fatty acid, the threes, the omega threes, omega six, and the other different ones, and then vitamins and minerals. So those are the fundamental building blocks of food. So whenever we eat food, that's really what we get. But in someone who have problem with digestion, and some of the food is not being broken down properly, you actually get a chunk of the protein. And when it comes to reaction or allergic reaction, is usually your body reacting to the protein of the food. Um, and then reaction to the sugar or the other type of sugar like lactose intolerance is usually more like an enzyme deficiency. I think last time I talked about a little bit about digestion, where the body needs very specific enzymes to break down very specific nutrients in the food. So that's why, like when you eat all this processed food that is not even real, the body's like, oops, I don't have the enzymes to break this down. Trash. So yeah, so that's the food allergies and stuff. And what was I going to talk about? Oh yeah, food. So we could be sensitive or intolerance to the protein, intolerance to the sugar, like in lactose intolerance, or some people have what's that? Oh, fructose intolerance too. I have patients with fructose intolerance. Other things that you could be intolerant to and you think might be a food reaction is actually the food additives in the food. Because again, like if you look at the processed food, they put so much artificial stuff in it. And actually, people, not just people with ADHD, I think human in general, probably there are a bunch of humans who cannot tolerate those food additives in the food, like those preservatives, like what BHT, and then the BPA, and then the MSG. Wow, that makes me sound really smart because I have all these acronyms. But anyway, like all these chemicals that are added to the food that wasn't there when Adam and Eve start living on this earth. So our intestine probably can't recognize that. And because big food companies have so much money to put out on advertising and say, hey, eat this and eat that. These are healthy and super convenient, fit it to your kids every day. But then we don't realize that there's all this garbage put into it. And a lot of these preservatives and things that are added in the food by food manufacturer is really not for our health. It's more for the health of the financial statement of the company, because when they add all these preservatives, they tell you, oh yeah, we add preservative to the food so it stays on the shelf longer, so you have longer time to eat. But that's only partially true. The real truth is that the food can stay on the shelf for over 2 years. So instead of only having a week's time to sell the food really quickly to avoid spoilage, the company now have like over 2 years to sell that food on the shelf for 2 years. So that means that overall they can sell more product because they have a longer shelf life. And second, the food is not spoiling, so that means that they reduce the expenses in food spoilage. So overall, the benefit is for the food company, and it might seem like for us as consumer, we have some benefit because the food stays on the shelf longer and it's already made, it's quick to prepare. But ultimately, you paying that cheap price for what? You're really paying for nothing. And if you're all here and you know that the account here is called Eat to Focus, or on Facebook is Natural Alternative ADHD Treatment. We're not here to teach you how to cut corners and eat all this junk food to try to feed your family. We're here to help you achieve something bigger, something that you as a parent want to do better for your children. So that's what we're here for. So um, yeah, so food additives is really nothing other than just chemicals. And food company, of course, tell us that, oh no, all these food additives don't do anything for the human body. Don't worry about it. Just enjoy your food. Keep buying our food. We want you to be our customer. But seriously, like if our whole body is run by biochemistry, right? Like our whole body is working because all this chemical reaction is working. Then why is it that when you put some kind of random chemicals in our body and we shouldn't expect a reaction? That just doesn't make sense. So I call bullshit on that and I don't recommend that. So yeah, so a lot of the food chemicals that are in the food actually is not food and can cause reaction in the body, and it's something that is not going to be um, identified on food, the blood food allergy test or the skin allergy test. And I've shared this particular story many times on my space here. Is like a few months ago, I think might almost be last year, I can't quite remember. It's just recently. I saw this child, like under 2 years old. Parents came to me because they the child was waking up every night, like 4 or 5 times every night, just every 1 hour he's wake up screaming in pain. His body and face is covered in a rash, and parents just can't figure out why. So they brought the child in to see the regular doctor. So the doctor, being a very good doctor, do all the right thing, right? Do the blood test, do the skin test, do all the testing, everything that she could think of. Everything comes back negative. All the tests are, they found nothing wrong with this child. So basically, the doctor is like, well, all the tests show that nothing is wrong with your child. So I don't know what's wrong. Maybe nothing's wrong with your child. All these things that you're describing probably is just all in your head. I think you guys should just be grateful that you live in a first world country with all the resources and all the good food available, and should stop wasting medical resources. And that's exactly what the doctor told the family. Like, and I, it's not like words that I hear from another person. This is actually documented in the doctor's note. That's exactly what the doctor put in her note, and that's the discussion she had with the parents. She basically told the parents that you guys are wasting medical resources. Nothing wrong with your child, but you know what? I'm just gonna send you to the dietitian. Maybe she can figure out something for you guys. So me knowing a little bit of the history, so I talked to the parents and find out what the concerns are, get a really good food history of the child, and also getting a history of the parents. So when I start asking the parents about any family members who have sensitivity to food or any GI symptoms or anything like that, that's when I discovered that that side of the family have a lot of food intolerances. So dad himself is sensitive to a lot of food additives, and I think he might have mentioned food coloring is one of it. And then he has either aunt or sister or someone, a female member on his side that's allergic to cinnamon and some other stuff, and then another family members on his side again who's sensitive to other food additives or things that are commonly found in food but is not a common food allergy item. So knowing that, I was like, okay, so knowing that history or knowing that family history, I was like, most likely your child have some sensitivity to food um, additives, not an actual food itself that he might be allergic to. So I sent the parents home with the instruction to keep a food log. So to write down everything that the child eats for the whole day, everything that goes through his mouth, and also the reaction that they observe in the child. If the child breaks out in rash on the face, I want you to write down um, face rash and then rate it from a 0 to 10. 0 meaning there's no reaction, 10 meaning all hell break loose type of reaction. So that's exactly what they did. So they did it for a week and come back to see me in a week. And I was like, you know what? I don't even have to tell them. Just the fact that they're keeping that journal and that log on their own, they discovered that the child is reacting to dairy or milk protein every time he drinks milk. The rash, he start having a light rash in the morning, and then as the days goes by, more dairy goes into the body. The rash get worse and worse as more dairy goes by and towards the end of the day. And the other thing that we also discovered was that anytime the child eat any processed food, things that comes out from a box, from a can, some kind of frozen toddler meals and stuff, the child breaks out in a face rash, or actually start screaming and crying. So then we remove all those products because it's a young toddler. So instead of taking milk out, I actually replace, because we're replacing a lot of things from the diet. I actually replace um, his milk and a lot of the processed food with a hypoallergenic formula. So that's what I did with the child. So within like a couple of weeks, the child behavior changed completely. Like the parents was just so surprised, like, oh my God, like the child now sleep through the night. He still wakes up here and there, but that's more of the normal toddler waking up in the middle of the night versus how he used to be waking up screaming and crying in pain. And then yeah, so parents realize that they can eat out at restaurant because whatever they use in the restaurant is causing the symptoms and the rash. So but for whatever reason, smart parents, right? Parents who actually pay attention, they discover that there are three restaurants that the child can actually eat at. So, and they said this restaurant is super accommodating, knowing that the child have like those sensitivity, they're able to make food that is specific for him. So yeah, they changed the diet for the child completely, and then yeah, all the symptoms disappear. So my point of the story is to let you know that food food allergy or food reaction is not limited to what is tested on the blood test or the skin test, but there's a lot more to just skin test and blood test, because we need to be more curious when it comes to trying to find something that works for our children, rather than just relying on the conventional choices of, oh yeah, this the blood test and skin test show nothing, so it's all in your head, just go back home and deal with it, right? We can't be that. Like, we need to be smarter than the system and ask more questions, and that's what I'm here for, is to help educate you, help you understand that why the conventional system doesn't work all the time. And I'm not trying to bash the conventional medical system here. I work in that system. I know what works and what not. And I'm just here to help educate and show you what other alternative is available. There's always room to have more option. No one ever complains having too many choices. Conventional medicine works. Like, I'm a product of that. If it's not because of conventional medicine, I wouldn't be here today. So I thank God every day for that. But I also want to educate people that you always have other choices. Medicine is an option. It is not the only ultimate option. And again, with food allergy, it's not always what show up on the blood test. It's what you see and observe in your child, because blood test is not 100% accurate. Even your doctors know that. They know the blood test is not, or skin test is not 100% accurate, especially in very young children. That's why I never recommend food allergy tests on young toddlers. They're 2 3 years old. their immune system is so immature. There's a lot of false negative and false positive. So I wouldn't trust that and wouldn't put my child through that. And that's also the reason why a lot of the food allergy and food sensitivities that happens in the first few years, a lot of times children are able to outgrow those because as their immune system gets better and better recognition and even the digestion, when the digestion get better, they actually have less food intolerances as they get older. And then all that kind of started again when people get older, like in the 30s and 40s, start having more food reaction. But anyway, that's my little spiel on the food allergy, food sensitivity, and I think next time. Oh, actually, let me cross out. I think so. Next week we're going to talk about um, common food deficiency of no common nutrient deficiency in kids with ADHD. So that's next week, and it'll be the same time, same place, same person, me. And if you want to learn more about um, common nutrient deficiency in kids with ADHD and how to correct that, mark it on your calendar and show up next week. All right. Okay. Thank you very much for everyone who showed up. Love talking to you all, and I'll talk to you next week. Okay. Bye.